Welcome to the Strong and Healthy After 40 podcast, where we talk about practical tips and strategies women over 40 can implement to improve their fitness, their hormones, and their metabolism. I'm John Agbelusi, your strength coach with over 25 years as a certified fitness professional, helping women over 40.
I'm Dr. Sara Whatley, a family medicine physician with an integrative approach to whole person care.
Sara, we're going to talk about a hot topic today, and something that's definitely a big topic for women over 40, and that is hormone therapy.
Ooh.
Yeah. So start us off, kind of maybe help us understand like what hormone therapy is, and why women are so interested about this.
Sure, it is a big topic and it is being talked about so much more, which is great. We've mentioned in other podcasts that there are shifts in hormones for women over 40. And there's natural phenomenons of going into menopause. But understanding more about that is important, and understanding also that we thrive with having our hormones in certain ranges. And so if that's an option for women, they should have the right information so they know if that's a strategy for their health.
Yeah, and it is definitely something that our clients are asking us about, because they'll do some research online. They'll ask us like, hey, what do you know about this? Or they'll ask if we know a doctor. A big topic is hormone replacement therapy. So tell us a little bit about what hormone replacement therapy is and why some women choose to implement that into their health routine.
Sure. So, hormone replacement therapy is giving back hormones that are decreasing or are gone, depending on where you're at in your hormone journey. So, any woman 40 and over is in some stage of perimenopause. That can also start in your late 30s, but we'll just say if you're over 40, for sure this is happening. And what that means is that there's just shifts in your hormones. It doesn't mean that you immediately will have symptoms. Could be happening in the background. And every few months or so, things do shift, and you might have a few symptoms, and those might go away, or certain things are changing. And what we want to do is come alongside our patients and help them, whether that is working on lifestyle changes in nutrition and fitness and sleep, or if it's supplementing with which gives them building blocks for hormones, or at a certain stage, we might actually give you back those hormones that are low in your body. And that's because every tissue in our body has hormone receptors. So as we age and those hormones are going down, we're going to see shifts in those tissues. That could be anything from our hair and skin changing to having hot flashes or night sweats. We're not sleeping. Our mood is changing. Our muscle mass is changing. Blood sugars are changing. And so the approach really is not cookie cutter. It's so individualized for each person, but knowing that, yeah, hormones are a big deal. They really shift for women. Men have pretty consistent hormones. There is a decrease in testosterone as men age, but it's one hormone only and pretty consistent through the month, which is cool. For women, we have many hormones that completely shift, not only every week, but through the years. And so just talking about that and understanding that is really impactful for optimizing women's health.
Yeah, it's interesting, especially when you talk about women versus men and health and hormones. There was a book that came out, I think last year, that I read. I think it's called The Great Menopause Myth by Kristen Johnson. Shout out to Kristen Johnson if she's listening. But one of the things that I found really interesting about this, one, she said that I think there's an interesting stat, only 53% of women can define what menopause is. And I think that was kind of surprising to me. The other thing that she did is she really kind of broke down the difference between health outcomes of women prior to 50 and men prior to 50, and then health outcomes of women over 50 and men over 50. And there's this shocking difference of like the health outcomes of women under 50, and they far are better than men under 50. But there's this big shift after 50 for women. Their health outcomes really change significantly with the increased risk of cancer and cardiovascular disease and autoimmune diseases. And a lot of these are really linked to hormones, right? And so maybe kind of give us a little bit more insight on like why hormones are so protective and why they're so important, and maybe why women choose to use replacement therapy as a preventative health option.
Sure. So, again, most of our tissues in our body, in a woman's body, have hormone receptors for estrogen primarily, some for progesterone, and many all cells also have receptors for testosterone, believe it or not. And so we're optimizing our health when those hormones are peaked at certain ages, which would be after puberty. And then those hormones are peaking in our 20s and 30s. And then in our 40s and beyond, as women, those are shifting. Now, for many, many reasons, we're living longer, and other reasons that, we would want to have hormones for longer as women. It turns out like we're not just here to like have babies and then we're totally useless. Apparently that was the deal back in the day when we didn't live much past menopause. But now that's different. And so that gives us an opportunity to look at these types of studies and health outcomes and say, okay, women are thriving before menopause, and after menopause, they're not. It turns out hormones are helpful for prevention of chronic disease. What has happened over the last few decades, unfortunately, is that there was some wrong data, ultimately, with regard to hormones for women. So any doctor who basically has gone to medical school in the last 30 years was probably taught not to give women hormones, that you're going to give women cancer, and there's a lot of bad outcomes, and just don't do it. And so, unfortunately, that wasn't accurate information. And so it's taken such a long time to undo some of that information that was given. And some of the stats are astounding as far as who's taught about hormones and hormone therapy within the medical field. So many primary care doctors aren't taught how to prescribe hormone therapy. And even gynecologists, who are the primary physicians for women, are not always taught about menopause. We are taught about birth control pills. We are taught about having babies. And then after that, it's like, oh, well, it's natural, it's normal. But it may not be optimal. And so because of that, there wasn't a lot of discussion, and ultimately there was a lot of suffering for women, a lot of cardiovascular disease, which is the number one killer for women, and then also osteoporosis, Alzheimer's, and diabetes and other neurodegenerative disorders that are actually prevented when you are given hormones. So the first thing is to dispel the myth that hormones cause cancer. Okay, they don't cause cancer. Should you be under the care of an appropriate doctor and have appropriate screenings before having, or in concurrence with the discussion of hormones? Absolutely. But hormones don't cause cancer, number one. So if we dispel that, it might open the door for a lot of women to say, okay, I'm open to the discussion. Are hormones a good idea for me? And hormone replacement could be a prescription or compounded medication, whether it's a patch, a topical, or a pill, or a cream, depending on what's appropriate for you, that help you to meet you where you're at with your symptoms, and then optimize your blood levels as well as your symptoms to get you to those health goals.
Yeah, I love that. And so much positive stuff to unpack from that. When I have clients that are really asking me to refer them to a doctor, some of the main reasons that they're asking, kind of like for more direction, more information, is because of some of the things that they're seeing in the gym. They're doing everything right, and this definitely, there is definitely this demographic of women that are, perimenopause or menopausal, that, they will do all the things, they're very serious about their health. They get more sleep, they eat enough protein, they really focus on, eating the right foods, getting the right type of exercise. And yet they still struggle. Like when we really look at their data, they really still, in some cases, struggle to get the results that they want. They're struggling to build lean muscle tissue. They're struggling to lose fat. In fact, for some women in that demographic, they'll do all the things and then they'll still see an increase in belly fat, right, specifically. So maybe help us understand from, you talked about the medical perspective of like how preventative it is, but let's talk about maybe from a, hey, I want to look better and feel better perspective. How can hormones really help?
Yeah, absolutely, because that's what matters too. We want to feel our best. Me as a doctor, I want certain outcomes too, but we do want you to feel your best. And so, with regard to that, when we see our hormones going down, then that is going to affect all tissues. It's not just about how my skin looks or, whatever other categories that we want to attribute to that. Like if our estrogen goes down, for example, that's our insulin opposing hormone. And so that means it keeps insulin in check. That's our blood sugars. And so as that naturally goes down, we're going to see the sugars go up. And then what is that going to lead to? In real life, we're going to see weight gain. And we might see that midsection weight gain. All of a sudden, now I have this stomach that just won't go away. What is happening? Another thing that we'll see is sleep disruptions, which could be from estrogen or from progesterone. Progesterone is our cortisol opposing hormone. So if we have less progesterone, cortisol is going to run higher. It might disrupt our sleep. We might start to experience anxiety that we never really felt before. So these things matter. And then in the gym, we might say, gosh, I'm working out, but I can't seem to put on muscle mass. Well, it turns out there's receptors for estrogen on your muscle cells. And so that affects the quality of our muscles as well. And so it doesn't mean you have to have those hormones, but understanding like this is going to physiologically affect your body. But if we wanted to give you hormones appropriate for you specifically, then we want to target those types of things. Am I able to put on muscle mass? Should I have just estrogen and progesterone? Or is adding in testosterone appropriate, which can also help with putting on muscle mass, as well as strengthening your bones. And it's not something that we always think about with women. We think about testosterone primarily as a male hormone, but women have a lot more testosterone than we realize because that helps us also with our mood and with our motivation.
Yeah. Yeah. And I'm glad you brought that up because, when I'll have this discussion with a client, maybe she's in that menopause phase and really doing all the things but struggling to get results, I'll ask, if she's talked to her doctor about hormones. And a lot of the responses, like you talked about earlier, there's this preconception that, oh, that's not good for me, or, oh, that's going to lead to a lower health outcome. And so a lot of women, I think, are afraid. So I'm really glad you brought that up from a standpoint of, hey, it's beneficial not just from the health outcome side, but also, hey, if you're doing this program and really wanting to improve your muscle tissue, not just your strength, but your muscle tissue, the quality of your muscle tissue, your energy, your level, your energy level, and your sleep quality, this is going to improve everything, all of those aspects. So that's huge. And I really want, definitely my clients that I work with and our listeners in general to really know how beneficial it can be under the care of a physician, for sure.
And to understand what am I looking for, what am I asking for with my doctor, because they may not be familiar or they may have been taught, okay, this is not appropriate therapy. Now we know, okay, it is appropriate therapy, but what do I do? How do I support these women? So it's important to just get a baseline. Even if you're in your 40s, some doctors might say, oh, if you're still cycling regularly, like your lab levels don't matter. Or they might not know how to interpret it. So there's different types of labs that are helpful, the timing of when you do get that blood work. And taking everything into context as well. Again, it's very individualized. It's not cookie cutter. Hormones aren't always the answer as well, especially in perimenopause. We want to blame it on hormones, but sometimes it's other things. But you want to work with someone who can look at the whole picture and say, okay, is it time for hormones? Is that appropriate for you? And would that be beneficial? Or maybe we need to start somewhere else, because hormones only work as well as the environment that we put them into.
Yeah, I love that. And you really hit on a couple things that I think women can have, conversations that they can have with their doctor. So maybe a couple questions. Let's say a woman is perimenopausal, menopausal. What are some key questions that they want to ask their doctor?
First, ask your doctor if they're comfortable with checking hormones or prescribing hormones. And it's a fair question, and that doctor might say yes, or they might say no, and then you can say, okay, are you willing to work with me on this? And they might be, no one's ever asked them before. Or if they're not, then you can just say, okay, great, that doctor serves a purpose for whatever other health aspect, and then you can work with someone else for your hormones. So that would be the first step. Do they know what they're doing? You don't want to just force your doctor to give you the hormones just because they're able to prescribe, because they might not be prescribing the right thing for you or know how to adjust that as you need it. The other would be asking them, what blood work would you order to check my hormones? Because there's some basic levels that you can get. And of course, I'm a big fan of more data. So we can also post a list of some different more in-depth hormone labs to check for women. And then also timing of, asking your doctor, okay, what time of my cycle should I be checking my labs if you're still a cycling person? And so those would be some good conversation starters. If you're told, labs don't matter, or no, I don't do that, then just move on to someone else who can help you the way that you need to be helped.
Yeah, I love that. And we don't have to get too in depth into it on this episode. And definitely we'll link some very helpful tools in the description of this episode. We'll link to some PDFs and some helpful material that can help women. But maybe just give us a quick overview. So we talked about blood work. What other tests are available for women to really look at hormones? And maybe what specific markers in their blood are they looking for?
Sure. So if you are postmenopausal, that means that you've been a year without your menstrual cycle, then on blood work, your levels of your estradiol and your progesterone are going to be low. That's normal. Your tissues aren't really making that hormone anymore. And then testosterone can vary throughout our life, pre or postmenopause, it doesn't matter. In perimenopause, there's blood work that we can check at different times of your cycles in different ranges. So there's normal and there's optimal. So it really does take someone interpreting it that understands what they're looking for. There's also some other types of testing, for example, something called the Dutch test, which is a urine test that helps us to expand out. Whereas the blood work is a quick snapshot, the Dutch test is over a few days and kind of helps us understand how you're metabolizing those hormones. Everything has its usefulness and its context. There's not one end-all be-all. It always has to be interpreted for that specific person.
Mm-hmm. Yeah, so that's great. So you talked about different phases of life and different tests that women can take. Is there a point where a woman should be like, I don't need to get my hormones tested, or is it really, and I'm talking about women maybe who are in menopause, who, like you said, have gone 12 months without a cycle. Should they say like, I don't need my hormones tested, or is it just as important?
I like data. So I think testing is always important, but there's also different ways of approaching that. Some women go through menopause, they have no symptoms. Maybe they had a hot flash for a month and then it went away. And so symptom-wise, that might not be something that they're thinking about. So that does happen, believe it or not. And then there's women who do have a lot of symptoms, and we would say, okay, we might be considering some hormone replacement. In both groups, I still like to have the conversation because your body did change. You went through menopause, you don't have hormones that you had before, and you were thriving. And I want you to know how that's affecting your tissue. I'm not going to push you into anything you don't want to do, but I do want you to know what this leaves you at risk for, whether you have symptoms or not. So in both women, I would want some baseline blood work, knowing, okay, things might be in a range showing menopause, but if they're far off, then I also want to know that, because that tells me some other indicators of other things going on in your body. The other tests would be getting some diagnostics, like a bone density scan, which is really regardless of age. Even if you're in perimenopause or menopause, we don't want to wait until age 65, which is the gold standard for checking for signs of osteoporosis or osteopenia, which would be weakening of your bones. That having that earlier gives me more indicators of how your health is and whether or not hormone replacement therapy would be beneficial for you. The other test would be a calcium scoring scan. So this tells us if you might have any hard plaque in your arteries or any heart disease going on. And that can help us, again, just get a better idea of all of your health and risk stratifying and understanding if adding hormones would be beneficial for you. Symptoms or not, would this benefit your bones,
Yeah.
your brain, and your heart?
Yeah, really good. So let's talk about a three-step solution. We always try to give our listeners a easy to implement action plan. So, if you're a woman, in your 40s, perimenopause, menopause, what 3 steps do we really want to work on to help them decide if hormone replacement therapy is something that they should do? Now, I'll give the first one because you talked about it extensively. And like you said, having that conversation with your doctor, I think that is the first step. And, asking your doctor if they're comfortable talking to their patients about this. So we'll take that as the first step. What other two should we have our listeners do?
Some diagnostics, which would be your blood work. And if you're working with a practitioner who's comfortable with talking about hormones, getting your blood work. And depending on your age and stage, maybe a cardiac test and a bone density test. And then the third, I guess this might come first, but would be tracking your symptoms. Tracking cycles, tracking symptoms that you're having, because again, sometimes it's hormones and sometimes it's other things. So data is important. We might feel tired every day, but let's start tracking our sleep, our food. Am I feeling fatigued? Am I irritable, moody? All of these things do matter and really help your practitioner to start to identify patterns that help us either order the right diagnostics or create the best treatment plan.
Yeah, I love that. And I think those are 3 steps that all women can start implementing. And I really love this conversation. For me, I'm really helping, I'm understanding, and I think a lot of our listeners are understanding that, hormone replacement therapy, it's not be all end all. It's not like a silver bullet that fixes all problems, but can be part of, a whole body integrative strategy to help them get the health outcome that they want. And so I think that's super beneficial for our listeners to know.
Yes, hormones are a part of our life. They do shift for women in your 40s, and hormone replacement therapy can be very complementary to optimizing your health.
Yep. And if you want a list of strategies that Dr. Sara recommends to really optimize your hormones and also check for hormones, as well as a list of questions to talk to your doctor about, we'll make sure we post that in the description of this episode. Make sure to like and subscribe, and make a comment on questions or comments you have about future episodes that you would like to see. Until then, we'll see you.